In this video, you'll get a quick overview of Vibrant's NutriPro test. I'll explain the Vibrant advantage and the technology used. Then I'll walk through each section of the test, highlighting key features. I'll also suggest complementary tests and end by summarizing the key takeaways and where to go for additional information. More than 2 billion people suffer from micronutrient deficiency worldwide. Micronutrients play a vital role in energy production, hemoglobin synthesis, maintenance of bone health, adequate immune function, and protection of the body against oxidative stress and cellular damage. Assessing intra and extracellular nutrient levels alongside genetic variations impacting those nutrient levels is the only way to objectively determine root causes of malnutrition and inflammation. Specifically, it can help differentiate between dietary, genetic, and other factors that impair nutrient metabolism or absorption. Uncovering micronutrient deficiencies is an easy and critical step in addressing chronic conditions and healing. Vibrant's NutriPro is a 2-in-1 test. It identifies genetic variations impacting nutrient levels and also measures serum and intracellular levels of vitamins, minerals, cofactors, amino acids, metabolites, antioxidants, and essential fatty acids. In other words, the NutriPro test can help identify nutrient deficiencies, which are an underlying condition for many clinical diseases, and learn if genetics are making it difficult for your patients to absorb nutrients or convert them into a usable form. Vibrant's NutriPro test is a serum blood test collected via venipuncture. Fasting is not required. However, serum, aka extracellular amino acid results, may reflect dietary protein or amino acids consumed 8 hours prior to collecting a blood sample. It is at the ordering provider's clinical discretion whether to recommend fasting before the NutriPro test. Additionally, there are no dietary or supplement restrictions. However, ordering providers may decide at their clinical discretion whether to test their patients under supplemented or non-supplemented conditions. Finally, there are no medication restrictions. However, acute or chronic infection may alter total white blood cell count, which may alter white blood cell micronutrient test results. More on this in a minute. Vibrant's NutriPro test uses multiple methodologies, including inductively coupled plasma mass spectrometry for metals, minerals, and liquid chromatography with tandem mass spectrometry methodology, or LC-MS-MS, for quantitative detection of most other micronutrient markers. These methodologies are powerful analytical techniques that combine the separating power of ICP and LC with the highly sensitive and selective mass analysis capability of triple quadrupole mass spectrometry. In fact, mass spectrometry is the gold standard for detection of small molecules. Vibrant's NutriPro test also uses real-time PCR methodology for accurate identification of genetic variations. Briefly, genetic material is extracted and purified from blood samples, and a SNP, or single nucleotide polymorphism, genotyping assay is performed to detect the specific allele targets for each assay performed. RT-PCR is the gold standard for identification of genetic material, so results are both accurate and precise. Before we dive into the actual report, I want to remind you that you get to choose how much information to include in the report you download for yourself or the report you share with your patients. You have 3 options: summary, interpretation, and all markers. I'll be going over the report that includes all 3 options combined, as it is the most comprehensive. Let's start with a quick overview. The NutriPro sample report includes a cover page, introduction, summary with interpretation, and then lists all markers. The cover page identifies the sample type and includes the results interpretation key. The introduction page is where you can find the methodology and interpretation of report, and I highly recommend reading this page, especially the part where it says, reference ranges have been established using a cohort of 1,000 apparently healthy individuals, and also the part where it says, the variant alleles are indicated with a plus symbol and the wild-type alleles are indicated with a minus symbol, as well as the part that explains the classification of red indicates a result that is outside the reference range, and the classification of green denotes a result that is within the reference range. The summary shows the elevated and moderately elevated results along with the interpretive comment. And the full report lists the results of all markers, including vitamins and minerals, amino acids, fatty acids, and blood cell count. Blood cell counts are reported as both a number, and plotted graphically so you can visually see how high or low your patient's results are. The NutriPro test measures and reports total white blood cell count, neutrophil count, and lymphocyte count, so you may critically interpret results. What does this mean? Well, normal white blood cell counts are needed to ensure accurate results, as intracellular results are calculated and expressed as a ratio of total white blood cell counts. For example, if you have a large number of white blood cells, your sample will inevitably have more nutrients than if you have a small number of white blood cells. However, if your patient's white blood cell counts are out of range, either too high or too low, not all is lost. You can simply shift the values up or down based on their white blood cell counts. For example, low white blood cell counts may falsely concentrate the analytes, resulting in false highs. For example, 2 divided by 10 equals 20%. To adjust for low white blood cell counts, keep in mind that the actual intracellular results may be lower than reported. On the other hand, high white blood cell counts may falsely dilute the analytes, resulting in false lows. 2 divided by 100 equals 2%. To adjust for elevated white blood cell counts, keep in mind that the actual intracellular result may be higher than reported. Since the NutriPro includes genetic predisposition alongside serum and cellular levels, all three are reported on the same page. Additionally, current and previous nutrient levels populate side by side so you can compare the results over time. The nutrient on the left will be flagged red or yellow if there is genetic risk, or when the nutrient level itself is out of range. In this case, no mutation was tested for chromium, but chromium levels were too low, only 0.06 when the reference range indicates it should be between 0.1 and 0.7. If you want to learn more about genetic predisposition flagged as yellow or red, you can scroll back to the summary and read the interpretive comment, which explains the genetic mutation. If you want to learn more about nutrients that are outside of the reference range, you can scroll back to the summary and read the interpretive comment, which includes physiological function, how it gets depleted, clinical manifestations of depletion, food sources, and supplement options. You can take an even deeper dive by checking out the NutriPro Interpretive Guide in your provider portal. So, which patients benefit most from this test? Well, patients with the following health conditions and/or health goals would all benefit from the NutriPro, such as optimizing health for athletes, optimizing health for expectant mothers or during preconception, people who have nutrient excess, nutrient deficiencies, nutrient malabsorption, people with anemia, mood disorders, cardiometabolic disorders, bone-related disorders, neurological disorders, age-related disorders, autoimmune disease, polypharmacy, and increased toxin exposure. Before we talk about complementary tests, I want you to think about Dr. Sidney Baker's TAC rules. Rule number 1. If you're sitting on a TAC, it takes a lot of aspirin to make the pain go away. In other words, it's difficult to heal if you don't identify the root cause of your symptoms. Rule number 2. If you're sitting on 2 TACs, removing one does not necessarily result in a 50% improvement in symptoms. In other words, sometimes there's more than one root cause contributing to your symptoms. So in addition to the NutriPro, consider the gut zoomer to test for microbiome, inflammation, and digestion-related influences on nutrient status. Also, the wheat zoomer to assess for increased intestinal permeability, aka leaky gut, celiac disease, and gluten and wheat sensitivity, all of which can impact nutrient status via malabsorption. Also, the food sensitivity test, which may be a sign of leaky gut and poor digestion. And finally, the total toxic burden, which includes mycotoxins, heavy metals, and environmental toxins, as toxins do increase utilization of many nutrients as antioxidants are upregulated to counter their negative impact. And also, in a catch-22, poor nutrient status does increase intestinal permeability and impairs detoxification pathways, which increase the total toxic burden. In summary, Vibrant NutriPro test uses gold standard RT-PCR methodology to identify genetic variations impacting your patient's nutrient levels, and also uses gold standard LC-MS/MS and IC-PMS methodology to measure serum and intracellular levels of vitamins, minerals, cofactors, amino acids, metabolites, antioxidants, and essential fatty acids, helping you uncover the root cause or causes of your patient's symptoms so you can create personalized treatment plans to resolve their nutrient deficiencies, address chronic conditions, and improve their quality of life. To learn more, visit the link in the video description. If you have questions, please ask them in the comments below this video. Thanks for watching, and I hope you have a vibrant day.